Hi. So we're going to start with a new topic, and that is anti-cancer drugs. Now, before I get into the anti-cancer drugs, so you should know what is cancer actually. So what is cancer? It is actually nothing but it is an abnormal proliferation of cells. So the cells are going to proliferate. ठीक है, divide करेंगे, multiply करेंगे abnormally. Abnormal proliferation of cells. These are your neoplastic cells, cancer cells. कि हमारी body में what happens usually, there are certain organs, they will stop multiplying. Your cells would stop multiplying after a certain age because they have reached, like, they're grown, and they don't grow. Your brain doesn't keep on growing throughout your life. Your heart doesn't keep on growing throughout your life. Okay, so what happens is that after some time, the cells, they will stop growing. That's the normal. And there are certain cells in your body which will actually, they are shed off, and then new cells are formed, and it happens throughout your life. For example, your skin cells, your GIT cells, okay? Even in the bone, everywhere. So in cells, it is over throughout the life the process occurs. Like, cells will shed, and the older cells गिर जाएंगे, and the newer cells will take their place. So that happens normally. But in these cancer cells, if for example it's the cancer of the brain, there will be abnormal growth of cells that will not follow your normal protocol कि भाई अब नहीं grow करना. They will grow. And when these cells grow, what they do is they will definitely take up, they're not normal. So उनके लिए जगह तो है नहीं हमारे brain में. So they will take up space. They will try to push the other structures in the brain here and there. That leads to various signs and symptoms. They will try to take the nutrition from the normal cells. So जो normal cells के लिए nutrition है, वो cancer cells ले लेंगे. So जो normal cells है, they're deprived of the nutrition, the blood supply, oxygenation, all those kinds of things. So they will, जो normal cells है, they will actually then start, the effect will show in them. Or they will go in to the bloodstream. अगर cancer इतनी in the later stages, they will travel into the bloodstream or the lymphatics, and they will go to any tissue in the body. अगर brain tumor है, पर वो body के किसी भी tissue में जाके चला जाएगा because of the blood travel through blood and lymphatics and start growing there again, perform its bad functions. Normally ऐसा नहीं होता कि आपके brain के cells जो हैं वो आपके liver में होंगे, something like that. It doesn't happen. But cancer cells में कुछ भी possible है. ठीक है, so that can happen in them, and as I told you, so they will abnormally keep on growing. Now, how would you actually, what are the various treatment approaches towards cancer? अगर एक mass है आपकी body में, which is in any organ which is not wanted, it is multiplying abnormally, so you would want to take away that mass from your body. That would be the best possible approach. तो अगर possible है, then the surgery is recommended in case it is possible to remove that mass without harming the other structures. Sometimes surgery is not possible. You can do radiation therapy. ठीक है, so radiation हम देते हैं towards that cancer. So it will try to actually hit the cancer cells, and of course the other cells are also affected, and it will try to fibrose them, shrink them. That's the effect of these radiation. The third approach that we are going to do is your drugs, and that is called as chemotherapy. Cancer chemotherapy जो हम करने वाले हैं. So you give anti-cancer drugs to these patients. Now the chemotherapy, जो anti-cancer drugs हैं, broadly हम 3 categories में we can classify. The first one is cytotoxic drug therapy. So you give drugs which are going to kill those abnormal cancer cells. But this kind of cytotoxic therapy, they can kill any type of cancer cells. So they are not specific to that particular organ. Okay? So they will definitely attack the cells which are abnormal, but they will also attack the normal cells. So because they are cytotoxic in nature. The second, which is better, is your targeted drug therapy. So they will target a particular organ which has cancer. So they are more targeted, would lead to less of adverse effects. The third one is hormonal based therapy, hormonal based therapy. So here what you do, you give hormones, because certain cancers are hormone linked or hormone dependent. So we use their antagonists actually to suppress or kill those cancer cells. So these three are the broad three groups of drugs which use an anti-cancer. So we are going to start with the cytotoxic drug therapy. Cytotoxic drug therapy, in the name से आता है cytotoxic. It is toxic to the cells. ठीक है? So it is toxic to cells, and they are more toxic to the cells which are rapidly multiplying, because you're giving them for anti-cancer therapy. Obviously, you make these drugs so that they target the actively multiplying cells. So अब cells की हम बात करें, every cell goes through a cell cycle. ठीक है ना? Cell cycle में ऐसा होता है कि the cells which are replicating, they go through different phases. So what happens from the G1 phase? The G1 phase is a gap phase where the cell is preparing to synthesize the DNA. So this is actually a gap 1 phase. ठीक है? A gap phase होता है. Then it is the S phase. S phase means it is a synthetic phase. Synthetic phase means it is for DNA synthesis. ठीक है? So once DNA is formed, then the cells pass into a G2 phase. It's a gap 2 phase. And here the cell prepares for the M phase, and that is your mitosis, where there is replication of chromosomes. So daughter cells form हो जाएंगी, and this is how your cells multiply. उसके बाद अगर वो cell has to continue growing, it will go into the multiplying, it will go in the G1 phase, or it can enter into the G0 phase, and this is your resting phase. So many cells in your body would be in the, many cells in the body are in the resting phase. They're not growing. Only few cells जो हैं वो grow कर रहे हैं. So this is your cell cycle. ठीक है? Mainly मोटा मोटा synthetic phase, 2 gap phases और एक mitotic phase. Now जो drugs करते हैं in this category of cytotoxic therapy. So what the drugs you give, they either are classified into cell cycle non-specific. इसका मतलब they can act at any phase, S phase, G2 phase, M phase, G1 phase. वो किसी phase में भी act कर सकते हैं. So they are non-specific to the cell cycle. The second group is cell cycle specific. So they are drugs which will either act only on the S phase, only on the G2 phase, only on the M phase, or only on the G1 phase. So they are called as cell cycle specific. So let's see what these drugs are. The first ones, which are the cell cycle non-specific drugs, these are your alkylating agents. So they are your platinum compounds, and we have some anti-tumor antibiotics. So they are non-specific. Cell cycle specific drugs. S phase के लिए we have anti-metabolites, right? Then for the G2 phase we have topoisomerase inhibitors and bleomycin. For the N phase we have Vinca alkaloids, taxanes, and for the G1 phase we have drug which is etoposide. So these are cell cycle specific drugs. ठीक है? So अगर हम इधर बात करें, यहाँ पे एंटी मेटाबोलाइट्स, ठीक है? G2 फेज पे हमारी जो ड्रग्स एक्ट करती हैं वो है टोपोआइसोमरेज inhibitors and bleomycin. M phase पे Vinca alkaloids, taxanes, और G1 phase पे etoposide. and जो non-specific है, it can act on any phase. That's the major difference between these two groups of drugs, right? Now, before going into the details of these drugs, we are going to do what their general toxicities are. And ये आपको हर एक के लिए specifically अलग अलग याद रखने की जरूरत नहीं है. For all the cytotoxic drugs, ये सारी उनमें adverse effects होते हैं. कुछ में like some of the drugs which will have one or two which are more prominent than the others, but otherwise they will be in all of the drugs. And the few examples of drugs which have those prominent toxicities which are not seen in the others, that I'll be taking up in the next lecture when I discuss the individual drugs. So for here the general toxicities, and especially they are true for those organs who have rapidly dividing cells, because you know they are targeting the rapidly dividing cancer cells. So they cannot differentiate between the normally which are cells are rapidly dividing. So उनकी चपेट में वो भी आ जाती हैं जो normally dividing cells of various organs. So जहाँ पे हमारे bodies में normally भी ऐसा हो रहा है कि वो cells rapidly divide कर रही हैं, they also are suppressed because of these anti-cancer therapy and the side effects result. So for example, the most common side effect seen with them is the bone marrow toxicity. So they are going to suppress because bone marrow cells भी rapidly growing होते हैं और multiplying होते हैं. So they suppress these cells of the bone marrow and causing bone marrow toxicity. So क्या हो सकता है इनमें? They can have decrease in the platelets, thrombocytopenia. They can have decrease in the WBCs, neutropenia, and RBC decrease, anemia. So patient will have thrombocytopenia, neutropenia, anemia. So thrombocytopenia के लिए you can give thrombopoietin therapy और prelvacin भी देते हैं. इसके लिए we give coronary stimulating factors. Anemia के लिए we need blood transfusion also in this patient, and we need erythropoietin. ये सारे हमें चाहिए. Then GI again is a rapidly dividing tissue, the mucosa. So there is shedding and there is new mucosa which is being formed, and if it doesn't happen, it can decrease. Shedding होती रहेगी, so there can be hemorrhages. ठीक है, patient can have diarrhea. Then oral cavity में there can be inflammation, just mucositis. Then it can stimulate the chemoreceptor trigger zone, and that leads to vomiting. This is so common. And इसके लिए आप you can give 5-HT3 antagonist, which is ondansetron. It's a very good drug for chemotherapy induced vomiting. Skin cells, they have especially the hair follicles, so they will suppress or decrease the number of hair follicles. ठीक है? So that's why these patients have falling of hair, which is called as alopecia. This is usually reversible when drug therapy is discontinued. Infertility, because the sperms and the ova, they are affected, the ovulatory function is affected. So it can be oligozoospermia, and in the females there can be amenorrhea. Lung toxicity like interstitial lung disease, fibrosis वगैरह, that can be occurring. Hyperuricemia is usually seen because the cells are rapidly, they're getting destroyed, and जो metabolize से destruction से क्या होता है, a lot of purines are released, and that leads to increase in the uric acid level. Treatment is your allopurinol for this. Others, like you can have some hypersensitivity reactions. Okay? Some drugs can have hypersensitivity reactions, nephrotoxicity, hepatotoxicity, etc., etc. But the first ones are more common, right? So these are the general toxicities, and in the next video I'm going to talk about the individual drugs, which are the cell cycle non-specific drugs. So let's just revise what we've covered just now. So we covered what is cancer and what are the 3 types of chemotherapies that we follow. So we follow cytotoxic drug therapy. One is very targeted towards that organ, and other is the hormonal based therapy. The cytotoxic mein we have drugs which are cell cycle non-specific. So they can attack at any phase of the cell cycle, like alkylating agents, platinum compounds, antibiotics, while there are certain drugs which are specific for a particular cell cycle, like S phase specific hote hain, G2 phase specific, M phase specific, and G1 phase specific, right? So then we have their general toxicities, and इसके लिए आप 4-5 toxicities हैं जो हर एक में आप लिख सकते हो. Bone marrow toxicity, GI toxicity, skin toxicity, infertility, and hyper. These you can write in any. Lung toxicity is more specific to certain drugs, but still जो ये 5 हैं वो आप हर एक में without blinking an eye you can write. They are true for all. Some will have more, some will have less, but they are present. Okay? So with this we come to the end of this particular video. I'll see you in the next video with individual drugs which are cell cycle non-specific. So till then, take care, study hard. Thank you so much.